Sharareh, can you hear me?
Mhm.
Okay, you can? Cool.
All right, we're live on YouTube. I'm putting myself on mute.
Perfect.
So we're still waiting for our attendees, right?
Yeah, unless they're on YouTube.
Right. Should we give it just a few minutes before starting?
Yep, sounds good.
Okay.
Okay, looks like we can get started. Hopefully everyone can hear me. Hi, I'm Shar. I work at the Disability Alliance of BC. I work at the Advocacy Access Program. And if you haven't heard of us, we're a nonprofit, non-government organization that helps with people with all disabilities to live as full and equal participants in the community. So we do that through a bunch of different ways, but our main way is through our Advocacy Access Program, which helps people to be able to connect with advocates. So if they need any assistance with government disability programming, whether that be applications, reconsiderations, appeals, and we also do a lot of systemic advocacy work. We also provide resources through our help sheets that are available on our website, and as well as through our Advocacy Access phone line. And I'll put up all that information at the end of the presentation so that you're able to kind of access the information that you need. Today, I'm going to be talking about the COVID-19 pandemic and kind of the impacts that that's placed on disability benefits provided through the government. Obviously, because the situation is continuously changing and the government is constantly putting out new information, the information that we're talking about today could very well change tomorrow or within a couple hours. So it's always important to check the news and the government websites for the most up-to-date information. As our website, we're continuously updating information on that as well. So those are always good places to check out. So first, I just wanted to talk about what kind of the major government rollout program is, which is, as I'm sure most of you have heard of, is the Canadian Emergency Response Benefit. So that is a taxable benefit of $2,000 for every 4 weeks for up to 16 weeks that the government has rolled out kind of in response to COVID-19. And the people who are eligible to receive this benefit are people who have had income of at least $5,000 in 2019 or in the last 12 months prior to the date of application. You must have lost or greatly reduced your employment income because of COVID-19. So that means that your loss of income has to be directly related to COVID-19, meaning you either got laid off or your job just doesn't exist anymore because of COVID. And it can't be that you lost your job unrelated to a COVID reason or that you're choosing not to work. So obviously, if you can't work because you're sick, that would count. But if you're just choosing not to work, that wouldn't count. As for the greatly reduced employment, so your income currently has to be less than $1,000 in order to qualify, and you have to be at least 15 years of age or older. So hopefully that makes sense to everyone. And this is, you apply for it through the CRA website. The application itself is quite simple. They just ask you some questions, and then based on the responses, if you're eligible, you'll qualify. Now, how does this impact people, obviously, who are already receiving benefits through the government? So for people who are on income assistance or PWD benefits, both EI and CERB are temporarily exempt. That means if you qualify for EI or CERB, you can apply for and receive the benefits and have it not clawed back from your income assistance or PWD benefits, which previously, obviously, this wasn't possible. You do still have to report any income that you have coming into the ministry. So that means if you have any EI or CERB coming in, you have to report that on the monthly report that you make to the Ministry of Social Development and Poverty Reduction. So this is for those people who were working through the annualized earning exemption and now can no longer work due to COVID-19. Now they did put something in place for people who don't qualify for EI or CERB. So that means those people who are either still having to work or people who weren't working before and therefore don't qualify for anything. So those people will receive a supplement of $300 a month for the months of April, May, and June. And that's something you don't need to apply for. That supplement will automatically be added to your check. So obviously, those of you who've gotten your April check already, that should already be on there. If it's not, you can check in with the ministry about that. Now, you can't receive both benefits at the same time, meaning if you applied for CERB and are approved, you shouldn't also get the $300 supplement. If for whatever reason you did receive the supplement, because CERB is retroactive, you want to hang on to that $300 because they will ask for that back. So for those of you who have received both the CERB retroactively and the April $300 supplement, hang on to that $300. Don't spend it because you are going to need to pay it back. So that's kind of how it impacts the provincial government. Obviously, the regular crisis supplements are also still in effect, and those you do have to apply for. For the federal government, it's a little bit different. CPP disability is based on people's inability to do any forms of work. Therefore, it's a little bit trickier in the sense that a lot of people on CPP disability were not working before COVID-19. However, for those of you who were working and making under the earning exemption of $5,700 annually, you can have made like at least $5,000, which means that you would qualify for the CERB. Fortunately, the CERB will not be held against CPP disability benefits and won't count as income, which means as long as you've made $5,000 in the last 12 months, you can apply for CERB while also being on CPP disability benefits. Unfortunately, no other benefits have been rolled out in relation to people on CPP disability. And this is something we're actively working towards, but so far we've heard nothing yet. So as for some additional benefits, BC Hydro has rolled out a COVID-19 relief fund. So if you are a BC Hydro customer and you and your spouse have stopped working due to COVID-19, you are eligible to receive 3 months of free credit on your BC Hydro bill. And they base that credit kind of based on an average consumption, your average consumption. So you apply for it online, and if it is approved, the credit is automatically applied to your account, and they also do that retroactively as well. So you could apply for it in June and still get it for May and April, which is great. So in order to be eligible, the account holder needs to be eligible for either EI, CERB, or the BC Emergency Benefit for Workers, which rolled out at the beginning of this month. So those of you who have applied for that, that would also count. So it has to be either you or your spouse, and you have to have stopped working because of COVID. You have to upload documentation that proves your eligibility. So something like a record of employment that shows that you've stopped working since COVID-19 happened, a letter of layoff, or something that shows you've been approved for either EI or CERB because of COVID. And your average monthly electricity consumption must not exceed 2,500 kilowatts per hour. So that's the BC Hydro COVID-19 Relief Fund, which is separate altogether from their Customer Crisis Fund, which was rolled out a while ago, which is to help people who are kind of at risk of disconnection. That is also still available. So people can also apply for that, which is a separate benefit in and of itself from the COVID-19 Relief Fund. And both of those applications are available online. Okay, I did want to go over the disability tax credit, which I feel like is going to be really beneficial to people right now because of the fact that CERB is a taxable benefit and people might not be used to kind of having this amount of money or this amount of taxable money coming in every month. So that kind of down the road, that might be a little bit shocking. So I'd highly recommend for those of you who think that they might be eligible for the disability tax credit to apply for it to kind of offset the amount of taxes that you would have to pay. So just to go over eligibility, the disability tax credit is available for anyone with a severe and prolonged impairment in physical or mental functioning. So according to the CRA, a severe impairment is someone who is markedly restricted in at least one basic activity of daily living, and they categorize that as vision, speaking, feeding, hearing, walking, eliminating, dressing, and mental functions necessary for everyday life. So that means in one of those categories, you're restricted 90% of the time, or you can apply for a cumulative effect of significant restriction, which means that in two or more of those categories combined, they restrict you 90% of the time. So for example, if someone has difficulty walking, but also has mental health impairments, and the combination of those two things restrict them, cause them to be restricted 90% of the time, they could qualify for the disability tax credit. Another way that people can qualify is also through life-sustaining therapy. So that means anyone who needs some kind of therapy for at least 3 times a week for an average of 14 hours a week. So that could be people on dialysis or a diabetic who needs to administer insulin, keep a logbook, that kind of stuff. This form is entirely a doctor-based form. So I know that a lot of people right now are having challenges keeping in contact with their doctor or having their doctor fill out forms. So that might not be possible for you to fill it out right now, but it's something I would recommend people look into to kind of think about or take notes on in order to kind of contact your doctor once COVID is over and see if you would qualify for this. And then obviously this is something that we help with at the office as well. So we help by preparing sample documentation for doctors. So you take that into the doctor and it kind of helps the doctors with the language used and the amount of detail that goes into this form. That was kind of the bulk of the information that I did want to go over. I had quite a bit of time for questions. So I did want to go over if people need help either applying for or understanding kind of the different disability benefits. We have different programs that are available at Disability Alliance. So if you need help with PWD or CPP Disability or have questions about COVID-19 benefits, you can email us at advocacy@disabilityalliancebc.org, and you can contact us through our phone number, which I've put up there. It's 604-872-1278. We are all working remotely right now, so things are taking a little bit longer in terms of like phone calls to get back to, but as long as you leave a message with like your name and your phone number and what you're calling about, we do get back to everyone. Our tax aid program is still running also. So if you're needing help with filing your taxes, you can email taxaid@disabilityalliancebc.org or call 236-477-1717. And they can set you up with an appointment and do taxes for you over the phone. And then our Access RDSP program is also available. So if you're needing help with applying for the disability tax credit or have any questions about the disability tax credit or the registered disability savings plan, you can email rdsp@disabilityalliancebc.org or call 604-872-1278. So yeah, I'm not sure how questions are working right now. Great. Thanks so much, and feel free to reach out if anyone has any questions.